Hello everyone, welcome to today's webinar, Post-Traumatic Growth in Action with Ursula Whiteside, DeQuincy Lezine, and David Measle. It's the top of the hour, so we're going to get started. Before we begin the presentation, I want to cover a couple of housekeeping items. While you will be muted, I do think it's a good idea if you silence all your devices so you can focus exclusively on the webinar. If you haven't downloaded your workbook to help you take notes, or for some reason you didn't receive it, it's the handout that is in your control panel, so you should be able to download it now. We'll be answering questions towards the end of the webinar, but if you're like me and are afraid you're going to forget your question during the webinar, you can just type it in the chat box and then we'll answer it later. You can also raise your hand and we will unmute you later so you can ask your question. I think that's it for the housekeeping items, so let's begin. I'm Heidi Bryan and I've been working in suicide prevention since 1998 when I founded Feeling Blue Suicide Prevention Council, which is now known as Prevent Suicide Pennsylvania. I'm an attempt and loss survivor, and I've struggled with depression, anxiety, PTSD, and all sorts of things. Recently, I decided to try my hand at webinars and thought that I'd do them on topics I'm passionate about. I've been focusing on trauma and post-traumatic growth, and I thought it would be beneficial for you to show you some concrete examples of post-traumatic growth to you. Today we're going to be talking about the importance of practicing self-compassion as a demonstration to others, the genesis of lived experience organizations and work, and specific ways people with lived experience make a contribution to helping and supporting others. Today's presenters are three of my very favorite people in the world, and I am just so pleased that they agreed to be on the webinar. I hold them close in my heart and in high esteem, and I believe after the webinar you'll understand why I do. So without further ado, let me introduce you to them. Dr. Ursula Whiteside is a licensed clinical psychologist, CEO of Now Matters Now, and clinical faculty at University of Washington. As a researcher, she has been awarded grants from the National Institute of Mental Health, NIMH, and the American Foundation for Suicide Prevention. Clinically, she began her training with Dr. Marsha Linehan and serves on the faculty of the National Action Alliance Zero Suicide Academy. She is also a founding board member of the United Suicide Survivors International, and a member of the National Suicide Prevention Lifeline Standards, Trainings, and Practices Committee. DeQuincy Lezine is a suicide attempt survivor who has been active in suicide prevention since 1996, including roles in the development of national and state suicide prevention plans. He received his PhD in clinical psychology from UCLA and completed a postdoctoral fellowship at the University of Rochester focused on public health approaches to suicide prevention. Dr. Lezine is the co-chair of the Consumer Survivor Subcommittee for the National Suicide Prevention Lifeline and a member of the Steering Committee for the Suicide Prevention Resource Center. He is also the principal author of The Way Forward, Pathways to Hope, Recovery, and Wellness with Insights from Lived Experience from SAMHSA, which is published by SAMHSA. David Measle is a certified peer specialist, CPS, and CPS supervisor. In addition to his certification as a peer specialist and peer specialist supervisor, he is also a certified older adult peer specialist and a certified wellness recovery action plan facilitator. He is currently serving as a contracted administrator for the Pennsylvania Peer Support Coalition. In his time at the coalition, he has developed and implemented a number of new trainings, including a 3-day training to prepare CPSs to work in crisis services and an ethics in CPS services training. So, without further ado, I'm going to give you Ursula. And I'm changing the presenter, so okay, Ursula, we should be able to see your screen.
Great. Excellent. Thank you everybody for being here today, and thanks to Heidi. Heidi, I was just looking at your website again, HeidiBryan.com, and the resources that you have and how people can join that and learn more about the work that you do. And I was excited when you did the series on what to do after an attempt, and because that's, I find, when after working in an inpatient psychiatry unit, this is what families really don't know what to do or how to be helpful, and so I find the work that you do really important.
Thank you.
Yeah. I'm going to be talking today about a nonprofit called NowMattersNow.org and where that came from, how the background of it informs my current life, and how the way I approach my life informs the work that I do moving forward with NowMattersNow.org. One of the topics for today was the genesis of the organizations that we work at. And while I am not paid by the nonprofit that I run, I definitely consider myself an employee. So NowMattersNow.org, the genesis of this began in 2010 when I was working on an inpatient psychiatric unit and also on hospital psychiatry units, where we were consulting with medical floors to make sure that anybody who had mental health struggles, who was in there for medical and mental health reasons, or for medical who had a mental health struggle, got to see somebody who had some expertise. And what I experienced during that time was that there were enormous gaps, and that people were not empowered in that situation. And for people who've been in the mental health system for a long time, this is nothing new to them. But I had come from working with Marsha Linehan, where we were very much in equal partnership with the people that we worked with. So as a therapist, I felt like I was an equal partner. Maybe my patients wouldn't always agree, but that was at least an ongoing conversation we were having. It was at least a conversation. And what I found when I worked in the real world was that that was definitely not the case. And the voices of people who were on the other side were not represented. So my background is a treatment developer, so adapting treatments that have been shown to be useful to make them more accessible to the real world. So when I left my training, my clinical internship, I started a team of people who had had suicidal experiences. And some of those people were actually people who I had encountered while working in the hospital. So their experiences informed the work that I did, and they ended up becoming consultants because I'd remained in contact with them well after we completed, after I'd left that area, because there were so many gaps and such difficulty for people getting the resources that they needed. So anyway, the genesis of Now Matters Now is the suffering of the people that I saw, the suffering that I saw, that I experienced witnessing what was happening, and then the coming together of people who had gone through that together several years later to try and change the way research was done, at least where we were locally. And it got harder before it got easier. So we created a team of people who were consultants, who had lived experience, who were equal to other experts in research, which for whatever reason was novel to the organization I worked at. And so it was quite challenging. And so I guess what I'm trying to say is, in starting this organization, it got harder before it got easier. And getting through that, the team of people I worked with, Team Now Matters Now, or those with lived experience, we really had to have, as a rule, self-compassion. We agreed that no one was allowed to feel bad in regards to our organization. Up front, the only rule, so like there's like one rule in Fight Club. Well, there's one rule in Now Matters Now Club, which is that there's no feeling guilty, there's no feeling bad about what's going on. It's not worth that. And so whatever that may be, we figured it out as we went, but had that as a grounding as a grounding rule. And that work continues. The research project that was the foundation for NowMattersNow.org has wrapped up, and then the products that were developed are being used in other research studies. The nonprofit is actually a public resource. It's a website that includes videos of people talking about how they survived suicidal experiences by using strategies from dialectical behavior therapy. So there's a lot of things people do to manage suicidal thoughts, and this is just one way that has some evidence base, and that puts people who've been there in the front seat as leaders who are saying, this is what worked for me, it may work for you. We continue, my team, we still work together. We continue to collect videos. We continue to work on the website. We have volunteers who are teaching me all sorts of things about how to improve a website. They know a lot of things. They work at Microsoft and Google, and so I'm really excited about that. But I think in the sort of, it was dark when in 2010 when I realized naively, I realized what a problem this was. It was dark in 2012 when we tried to put this team together of people with lived experience, because people on the team were still struggling. There was no rule that in order to participate they had to be feeling better. The only rule is that they couldn't feel that they weren't allowed to feel bad about themselves in relationship to this, and that if they participated, that was because they wanted to, and I wasn't going to tell them whether they could or they couldn't. So it was hard that time, in part because of the organization we worked out. This was so novel and there was not a lot of support. And then it continues to be difficult. And so I think, I guess what I wanted to say is that when we think about traumatic growth, sometimes the trauma's not over while you're still going through the growth. So part of what I wanted to communicate today was that you can still be going through hell while growing, and that's not okay. That can be okay. You don't necessarily have to wait till you're through hell to have the growth and to continue to have an impact. And I think for the people who worked with me and who do work with me, one of their reasons for living is to be of use, or to maybe reduce the likelihood that somebody else having their experience has to struggle as much. And there are all sorts of reasons for living. I think maybe one really important thing we can do is never judge anybody for their reason for living. To say, like, that's not appropriate, that's not okay. We all get to choose what our most appropriate, or what is our reason for living. So, those are just a few thoughts. When we come back to the idea of self-compassion, I'm really lucky because I have permission to be kind to myself all the time. Meaning, I may not want to be kind, I may not have the brain makeup to be kind to myself, I may not have the history to be kind to myself, but because now I run an organization and I talk about these things, I essentially have to be kind to myself, because if I'm not doing it, I'm not showing anybody else that they have to do it. And so if you're listening, this is a trick that you can apply in your own life if this is something that you struggle with, that if I don't do this, and if I have an impact on others, which we all do, if I don't take care of myself, if I don't show others that I think I'm important, then there's a lost opportunity. And that really helps me keep it together. So for example, I'm working on creating one video a week that shares some of the tips that I have about getting through life. Some of these are related to dialectical behavior therapy skills, some are more random. And I'm intentionally not being perfectionistic on those videos because being perfectionistic would get in my way and I wouldn't get them done. So there's this self-compassion around it that allows me to keep going, and then also allows me to get out a message that I think is important, that somebody might might benefit from or value. We also thought when preparing for this webinar, we talked about ways you can contribute. And some of the ways that you can contribute or think about contributing are to start by identifying a problem. So what is it that you're encountering in your everyday life, or that you see in others' life, that is related to mental health? And then is there a way to get more clear about that? And then there are other experts that may know something about this, people that you can interview or talk to. These are some of the ways you can do it. Identify a problem, get more clear on it, find people who know about it, and be around people that make you feel good. These are all ways that are going to increase the likelihood, based on my experience, these are all things that are going to increase the likelihood that you can contribute in a way that feels meaningful to both yourself and is more likely to be meaningful to other people. So I'll just give you a couple of images from the nowmattersnow.org website. You see here a couple of members of my team here, and then the name of the skills. So these are different DBT skills: mindfulness, opposite action, and then there's stuff about suicidal thoughts. The entrance to the website basically gives people an overview or an orientation of what there is and why they're there. But essentially, again, nowmattersnow.org is a resource that includes people who've had suicidal thoughts, talking about how they got through them. Basically videos, people talking about how they got through suffering and treating themselves as if they are important, because they really are very important. So I want to thank you all for your time and attention, and I look forward to your questions and hearing from the rest of the panelists. I'm going to hand it over to Dr. DeQuincy Lezine now.
All right, let's see. That's the screen. Hold on just a second. This is not working. This is not working.
Wix, you have been plagued with computer problems this whole week.
I have, and that is not so cool, but Heidi, I think I sent you the slides as well in case this happened.
I
Oh wait.
don't think I do have. Okay, something's okay. We see your screen, so.
All right, that's good because I can't.
Yeah, it's in presenter view for some reason, but it's there, so.
All right, let's see if we can. All right, how's that?
It's a blank screen.
Good deal.
Now we got it.
All right.
Yay!
So, yay for sure. All right. So I had just completed a podcast actually with Dr. Sally Spitzer Thomas, and what we're talking about is the idea of making meaning, and that's out of our experience. And one of the major points that I was trying to make during that podcast was that in lived experience, we kind of frame our personal narrative in a way that makes sense. So I'm going to try to kind of briefly frame here what my narrative has been and how I've gotten to the point where I've created this organization that I'll talk about. So before I entered the world of suicide prevention, I was actually a double major in computer science and art. You see here the first part of a comic strip. I used to do a daily comic strip in the college newspaper. I was also a high school peer counselor, and I really liked social causes, and that's how I ended up at Brown University. So all of these different parts come together into how what I integrate into suicide prevention or into my work in suicide prevention. So the idea for the comic strip was our mascot was a brown bear. So I made bear characters and tried to just talk about day-to-day life in college with bear characters. And so this was one of the first ones that that I had done when I was talking about just kind of being a computer science student and just the idea of having code in your head all the time and not really being able to make sense of what was going on around you, kind of blanking out everything else. And so here you see Bruno not being able to handle programming Tetris and also doing all the other midterms. So the art was definitely a big part of my experience before I entered into suicide prevention. As it turned out, though, my first suicidal experience was in first year, and that led me to search for kind of understanding and trying to understand suicide and mental health in a way that would allow me to then convey that to others in writing and also in some art. But I did it for just a small group of friends at first. One of my first public advocacy efforts actually came in commenting on the unfolding suicide story of a fellow computer science student who died by suicide. And so I did that in the comic strip where I asked if they had heard about the suicide and underscored that it was a suicide, that somebody was troubled and possibly depressed. And I started putting kind of information about suicide along the bottom of that comic strip as well, saying that it was the third leading cause of death for people that age. But they were calling it an accident, and that was something that kind of disturbed me, and so that triggered kind of my more activist or advocate side, and that's why I put it into this comic strip. And so this was in memory of that student at the university, was kind of trying to cover it up in some ways to kind of protect the image. And so the focus on college students and on college suicide prevention has been something that has stayed with me since then, but it's something that got integrated into my art initially. And that was kind of my first advocacy efforts. A lot of people don't know that was kind of my first public advocacy efforts, was just kind of doing in that comic strip. If you fast forward a little bit from there, I had taken science and the understanding of suicide, and it made me switch into psychology, becoming a psychology major. And then I entered the PhD program as an open suicide attempt survivor because I had already been in national media by that time as a person with lived experience, as a person who had gone through suicidal times. I had been on CNN and a couple of other shows. And so when I entered grad school, I was already entering and discussing with folks as I interviewed about having personal experiences and what I would take into grad school, not only the science aspect of what we would be doing in research, but also this advocate perspective for having lived experience. And so the idea was to add knowledge and skills to my advocacy efforts, adding the knowledge and the type of clinical efforts that I would get through grad school. So fast forward then 20 years after that, the career trajectory stayed in suicide prevention and in lived experience. And honestly, it's been really tempting to get out of that quite a number of times, because it's a really challenging environment. You're kind of stationed at the crossroads, and at that type of juncture, you have the weather criticism from all sides. And sometimes there is criticism from the peers that I have in the academic community. Sometimes there's criticism from the peers that I have in the lived experience community. But I've still stayed in it nonetheless, because I found that it has been a worthwhile endeavor to try to work on things that can try to move things forward for other people who have lived experience. After working on the way forward that was released by the Action Alliance, and then making recommendations for engaging people with lived experience, the question was kind of how to implement that. And part of that was, how do you prepare people to be able to engage in suicide prevention work in a broad way, and so many different potential ways to integrate your experience into suicide prevention work. So how do you prepare people? The idea then was to create this Lived Experience Academy, and here you have the website for it. And so it's a website with resources. The aim is to achieve that type of preparation and also showcase what's been done by folks with lived experience, as well as suicide loss survivors, and contributing to suicide prevention. So this kind of, it brings together both my advocacy purpose as well as suicide prevention knowledge, and then the kind of lived experience perspective, my interest in teaching others and in kind of being a peer support person, as well as then using my skills in computers and technology and creative arts to kind of pull that all together in a way that tries to promote engaging folks with lived experience more in suicide prevention. So the type of things that you would find on the website, I try to focus on multiple categories, including just self-care. Again, as Ursula said, that's incredibly important as a basis or as a foundation for any of the type of work that we might be doing in suicide prevention or elsewhere, if we are integrating our lived experience particularly, as well as personal development, and then integrating some ideas about professional development, and then just regular suicide prevention information, or more specific to suicide prevention. I try to have some stories that are in showcasing what folks with lived experience have done. Here you see the book from Craig Miller, This Is How It Feels. So I have some of his work up there, as well as kind of highlighting programs in suicide prevention like Cognito's experience, and just a lived experience perspective on what those programs are like. And so that's what I have tried to create with this Lived Experience Academy and with prevention communities. I think that the idea that I would want to emphasize about post-traumatic growth is that it's about change, and you're adding something that didn't exist beforehand into the suicidal experience. And so what you learn and what you are able to strengthen and build and integrate into your narrative is something that becomes that growth perspective. And that's what I would want to convey to others, and have that be kind of the legacy that I would leave afterwards. I think that the idea of having peers be able to help each other is something that Dave has been really involved in, and so I'm going to hand it over now to Dave.
Okay, thank you. Give me 1 second here. There. I think that's what I want. This is my sole slide. This is just my contact information. And I'm going to kind of weave my story around to talking about the Pennsylvania Peer Support Coalition. But what I want to do is kind of give you a little bit of background about myself first, and kind of share some of my story. As a certified peer specialist, one of the things that we do often is share our story, whether speaking to groups or working with an individual one-on-one. Of course, working one-on-one, we have to share our story in a little bit of a different way, because we have to be careful to keep it about the individual as opposed to us. So our story kind of comes out over time and naturally. But I'm going to share with you some of my experiences in life that has led me to where I'm at right now. So I'll start off with my childhood. I was generally a laid-back, happy kid. I had a good family. I had friends. And on the outside, everything would have appeared to be fine, would have appeared to be good. But there was always, throughout my entire childhood and even into high school, there was always a level of self-doubt. Yeah, self-doubt, and a lack of confidence in myself, and just not believing in myself. No one at that time called it, diagnosed it as anything. I don't think I talked about it a lot as a child. I kind of kept that hidden from people. Continued through high school, as I said. But then in college, things started to get worse. Those feelings started to heighten. And I started to have episodes of major depression and debilitating panic attacks, anxiety attacks in college. I started college in pre-med. I had full intentions of going to medical school and becoming a doctor, and some of these issues got in the way of that. So I kind of took a step back from what I was working on, and focused on a different degree. And I did finish with a political science degree, but that was not my initial intent when I was in school. When I started receiving services in college for this depression and anxiety, I would describe it as being mostly what we would call the medical model type of services. I went to a psychiatrist. She gave me some medication. I went to a therapist. I don't know how much I got out of it. But at the very least, the medication was helping me with the depression and the anxiety. This is back in Michigan. I grew up in Michigan. And then in 2004, I moved to Pennsylvania. I had graduated from college. I had started what I had hoped would be a career with the YMCA. I had had an affinity to the YMCA for most of my life, going all the way back into childhood. And that was what I was going to do. I was going to work for the YMCA as my career. Life sometimes has different plans, or different ideas of what's going to happen with you. And as it would work out, I would lose my job at the YMCA, and of course, because of that, was struggling with my depression and my anxiety again. But through a couple of fortunate twists, I was made aware of a job at a consumer satisfaction team. And consumer satisfaction teams, for those of you who don't know what they are, they're teams made up of individuals who have their own mental health experience with a diagnosis, their own mental health challenges, who go and do satisfaction surveys of other mental health recipients, and see if they're getting what they need. In starting at that business, I was introduced to an entirely different way of looking at mental health. I had never heard the term recovery and mental health until this happened. And from the day I heard it all the way up to today, I am fascinated by the philosophy of recovery and mental health and all of the guiding principles that are under that. So I worked for the consumer satisfaction team for a number of years, and then an opportunity came to take the training to become a certified peer specialist, which I jumped at. And after taking that training, I worked as a certified peer specialist for a number of years, and now I work for this organization called the Pennsylvania Peer Support Coalition. So let me tell you a little bit about the Pennsylvania Peer Support Coalition. The Pennsylvania Peer Support Coalition was created as the professional organization that would represent certified peer specialists here in Pennsylvania. So I like to liken it to any other professional organization for any other profession out there. We have members, and we represent the voice of the CPS at the state level. We do trainings, we create trainings, and it's really exciting. One of the trainings that we created, and I'm going to bring this up because I have to give a shout out to Heidi, was the 3-day training for certified peer specialists working in crisis services. It's a training that CPSs can take to learn how to specialize in working with individuals who are in crisis. And Heidi and I were the co-developers of that training, and that was a phenomenal experience working with her. But specifically to talk about kind of the topics of today's discussion, and again, coming back to, self-care, as a certified peer specialist, we have to know how to take care of ourselves. And we have to know how to maintain our own wellness in order to be able to continue providing the services that we're providing. I shared with you earlier that, from childhood all the way up to this day, one of the things that I've struggled with the most is giving myself credit for anything that I do. Having any kind of self-confidence or belief in myself. Having self-compassion is something that I really struggle with. But it's something that if I weren't able to figure out how to do it, I don't believe I could have ever gotten to where I'm at. So having the ability to stop all of the negative thinking and all of those thoughts that are swirling around in your head, especially when you're at your lowest moments, that are telling you that you're worthless, that anything you do is a failure, and that even the things that aren't failure, aren't failing, aren't good enough. Controlling those thoughts and showing yourself a little bit of self-compassion, kind of like Ursula was talking about with her organization, saying that the only rule they had was that, they weren't allowed to feel bad about what they were doing for that organization. To me, that is one of the main keys to my own self-care and taking care of myself, is showing myself that self-compassion and allowing myself to be happy with something that I've done, or to be proud of something that I've done. I don't think I need to talk much about what kind of an impact certified peer specialists can have in working with individuals who are having, any kind of a mental health challenge. One of the nicest things about being a certified peer specialist is being able to sit down with an individual who might have real struggles going on in their lives and to say, look, I've had similar type experiences. I've had those kind of feelings. I've had those kind of thoughts. And let me support you. Let me stand next to you and support you from a lived experience perspective. I'm not coming at this as someone who went to school and learned about it from a book. I'm sitting down here next to you as someone who has experienced it deeply and personally. And being able to do that really creates a situation where there can be a bond, a rapport, a connection made quickly and deeply. I think if you talk to certified peer specialists, almost every single one of them would tell you that they have had experiences with their peers where the peer has said, I've never told this to anyone else before, or I didn't tell my therapist this. That happens because of the rapport that we can create, because of the lived experience that we have. But then our job becomes to figure out how we can make them feel comfortable to share it with their other supporters, to share it with their therapist. Can I support you? Can I come to your therapist's appointment and support you in sharing this with them so that we can all work as a team to figure out how to work through this? That's what is so most exciting and rewarding about being a certified peer specialist, is being able to share that with other people. So the Pennsylvania Peer Support Coalition, as I said, we're here. We represent the profession of all of the CPSs in Pennsylvania. I'm very proud to say that Pennsylvania has the most trained CPSs of any state in the country. Last number I had heard is that we have over 4,600 trained CPSs. We are growing in Pennsylvania. We're expanding into different areas. As I said, we created a training for CPSs to work in crisis services, so we're growing and pushing into, being integrated into crisis services, being integrated into emergency rooms and inpatient units and doing the mobile work. So it's really an exciting time to be a certified peer specialist in Pennsylvania and in the country. But I want to thank Heidi for giving me this opportunity to kind of share a little bit about myself, a little bit about the Pennsylvania Peer Support Coalition, and a little bit about what it's like to be a certified peer specialist in being able to share the types of wellness tools that I've used for myself personally with peers that I sit down with who are in a tough spot, who need help. So thank you, and Heidi, I'm going to turn it over to you now.
Okay, thanks, Dave. And I don't know if Ursula and Quicks want to join us, turn their cameras back on so we can address questions. There's Quicks. Okay. Thank you, the three of you. Thank you so much for your presentation and saying everything. And I have so many thoughts swirling through my head. First of all, Ursula, can you tell us where we can find your weekly video tips?
Oh, thank you. Yeah, so the weekly video tips are on the Facebook Now Matters Now page. So that's Facebook.com/Now Matters Now.
Facebook.com/Now Matters Now.
Right. And you can always friend or follow me to get access to that content as well, which is Facebook.com/Ursula Whiteside.
Okay, great. Thanks. All right, let me see what the questions are. I know we had a couple. Here's one. How do you build not feeling guilty when it seems deeply entrenched and the consumer's really not being listened to across many years of mental health engagement?
I'm happy to take a stab at this. So, man, there's a skill that's called opposite action in dialectical behavior therapy, and I use it every day. I go to meetings. I have in the past gone to meetings where I didn't feel welcomed. I didn't feel my opinion was valued, and it is absolutely so difficult not to take that on and believe it. But just because the people in the room don't have the context or the width of vision to see your value doesn't mean you aren't valuable. So I had to kind of constantly remind myself that even though I'm not seen as part of the picture, I know that I am part of the picture. And one of the things I always remind myself is, I asked Marshall and Linehan, like, how did you do this? You know, she was doing this work a long time ago, and she said, I knew I was right. And so I keep coming back to, like, I know I'm right. I know this is important, and I'm going to act like it is until they act like it is. And even if they don't, I'm still going to keep doing it. So it takes a lot of that, like, doing it anyway, pretending as if you are valuable, and knowing that behind you there's a whole lot of people who need you to do that, and that it's about them, and it's about the people who are with you or behind you with similar experience, not the people in the room who have no idea about that.
Okay.
Heidi, if I could have a second here.
Yep, please.
I have a couple of thoughts on this one. And we run into it as certified peer specialists all the time. You know, when you sit down with someone who has been in, quote unquote, the system for a long time and has been treated a certain way for a long time, they can be taken aback by a certified peer specialist or anybody who's sitting down from a recovery standpoint and saying, you know, you have worth, you have value, and I want to know how you're feeling. I want to know what you think you need to do to get better or to improve your life. I'm not going to sit here and tell you what you have to do. A lot of times it's hard for people to accept that because they've been beaten down for so long by the system, telling them all of the things that they're incapable of, as opposed to focusing on their strengths and focusing on what they are capable of doing. One of my favorite phrases that floats around in the recovery community is the concept of holding the hope for an individual who can't hold it for themselves. So, you know, as a certified peer specialist, if I had someone who was struggling with being able to believe in themselves, you know, I would let them know, hey, look, I'm going to hold that hope for you because it is there. and I'm going to hold it for you until you're able to take it for yourself.
Right. Good. Great. That's so important to, I love that, but I love the whole recovery concept. So, Quicks, do you have anything to add before we continue, or?
I'll let them go to the next question.
Okay. Ursula, is there anywhere else other than Facebook we can see your videos? Someone is asking. Margaret.
Oh, that's so nice. It is on YouTube. There's a Now Matters Now channel, so if you go on YouTube and you search for Now Matters Now, you should be able to find it there.
Okay, great. Thanks. And Rosalind says that very impressed, Dave. Congratulations, and you're very courageous. I thought that deserves to be read out loud.
Thank you.
Another question is when the reason for living becomes freedom, to be free of meds, this is of concern to the carer. It can have a sorry, I'm having trouble reading it. It can have, I guess it can be positive as you're determined to move forward. And in our case, it was meant as a shutdown in health professional assistance and as forced admission. So that's from Rosalind. Rosalind, do you want me, I don't know that I'm quite understanding your question, so do you want me to unmute you so you can ask? Rosalind?
I'm trying to ask the consumer, who is my son, his why in life at the moment is freedom. He will just say that out. Now, as a result of that and not being listened to, communication with health professionals has almost shut down. He's compliant and he's doing all he has to do under duress, but we're not having any input. So yeah, how do you work through that as a carer with him? I love what Dave said before, holding, what were the words, holding on to his hope for him. But any ideas here?
Okay, I'll turn it over to them. Thanks, Rosalind. Anyone?
So I think that I would kind of start from wherever that common ground is. So if freedom, we're attaining that, is the reason for living, or that's what he's trying to get to, that's something, the focus on having a life that is free from kind of the restricted part that could be associated with medication is something that I think doctors would agree to as well. Trying to get free of kind of both side effects as well as the effects that might be associated with a disorder. So I think that finding the common ground is the tricky part, but once you can get there, then it gives some basis for the rest of the work that has to take place. It can be hard to kind of negotiate in between something like wanting to get off of medication and what the health professionals might see as kind of the most beneficial pathway forward. But I think starting from the lowest common ground that you can find is the path that I would suggest.
Okay, thanks. Ursula or Dave, do you have any comments? Anything you want to add? Taking that's a no.
I'm trying to think, and no, I think what DeQuincy said is very appropriate. To me, it's always disheartening when I hear stories of individuals who are not being supported the way that they want to or the way that they need to. You know, especially when they have specific goals in mind of what they have, what their vision for their life is, and the services that they're receiving are not supporting that. That's disheartening to me, because that that is the antithesis of what recovery and mental health is. Recovery and mental health is supporting the individual in their goals, not in your goals for them. So when I hear things like, an individual who has a clear vision of what they want in their life and where they're moving and, the direction they're moving, and not getting the support that they deserve, that to me is, it bothers me.
Yeah.
But,
I know.
But other than complete system transformation, and I don't know anything about Australia's mental health system, other than finding providers who are willing to give the type of support that he needs. It's tough to say.
Yes.
I was just going to add too that we all came to where we're at for a reason, and the limitations of our training programs from the clinical perspective, the difficulties of being able to hold both our space and understanding of the world with somebody else's space and understanding of the world. Because I have the clinical training and I'm doing peer support at the same time, I can help people see the orientation of the provider and what the provider is like getting at or going towards. That really makes it easier for the person who's meeting with the provider to understand what's happening, just to bring things down a little bit, because the situation can be so disorienting when you don't know what the goal is. And then if everybody's confused, everything gets more intense. And so knowing things like, in general, providers don't want to hospitalize people. In general, they are more scared if they aren't able to speak directly with somebody. Some general things, not telling the person I'm peer supporting what they should or shouldn't do, but giving them some insight into why the clinician may or may not be acting that way. So maybe we need a survival tips for people who are interacting with clinicians about what's going on in their head and why are they acting the way that they're acting.
Well,
Yeah,
I think
good point.
one of the nice roles that certified peer specialists can fill, and we do this here, is acting as a bridge between the individual receiving services and the professional. We will go to appointments with our peers and try to bridge that gap.
Yes. So, sorry, I got distracted by other questions. The training you developed for your CPSs, is this specific to Pennsylvania, or is it available to other states that may want to request it?
We have not taken it out of state yet. We would certainly be happy to. There is one section in the training that is specific to Pennsylvania. It's specific to our Mental Health Procedures Act. But other than that, the training could easily cross state lines.
Love the focus on positive thinking and recovery. Did you find why you were hard on yourself in building your self-care?
I'm assuming that one was directed at me. No, to be honest, and I've been in therapy, and I've talked about this, and I've talked about, is it important to really understand it? And I think the idea is, if you can figure it out, if you can figure what the triggers are out, then that's great. But I've never really been able to figure out where it came from. I had a supportive family. I had a supportive group of friends. The only person in my life that was negative and telling me and feeding me messages that I wasn't good was my brother. He is the only person in my childhood who did that. So I could very easily just blame him, and I do. He and I get along much better now, so when we're together, I do blame him for all my problems. But no, I think it's part. I think my struggles are based a lot in chemistry and in the chemical makeup of my brain and whatnot. And for that reason, medications do tend to work really well for me. but I still have had to spend a lot of time in my life figuring out wellness tools that I can use to keep myself well, because medication only does so much. And I'm such a stronger person today than I was even 10 years ago before I'd heard of recovery. Learning about recovery and mental health has made all the difference in my life.
Yes. Excuse me too. And I think this question you can all answer too. How long did it take for you to reach this level of self-compassion, and did you have the support to make it to this point? I think that applies to all three.
I'll talk first, and then DeQuincy and Ursula go, because I've kind of already answered this a little bit. I discovered the principle of recovery and mental health after I moved to Pennsylvania, which I moved here in 2004, but it wasn't until probably 6 or 7 years ago that I learned about recovery. And that really has made a huge difference. There was a second part to the question, Heidi.
How long did it take you to reach this level of self-compassion, and did you have support to make it?
Yes. I've been very lucky in my life, throughout my whole life, that I have had a decent natural support system. One of the challenges in Pennsylvania is most of my family still lives in Michigan, but they still support me, and there's still ways that I can be in contact with them. There's a huge recognition that natural supports make a tremendous difference in an individual's ability to recover. And my personal experience is that I've had that, and I thank God for that every day.
Thanks. DeQuincy?
I'm sure. I'd say that kind of self-compassion is an ongoing journey. It's something that kind of keep working on for, I don't know, for a long time, because there's always new challenges and there's always new things that kind of come up that present opportunities to either be hard on yourself or to give yourself some compassion or love. I think that I probably started with friends and social supports that I had in college, and have grown since then, bringing in supports from folks like Heidi and folks like Ursula and other peers who I consider both friends as well as colleagues. And then just kind of, as well as self-help and learning and trying to continue growing and continuing to pull information from different sources. Like I just attended a webinar by Lisa Firestone talking kind of about the inner self-critic and how you talk to yourself and how you integrate those voices and change those voices or change your views of self. So just kind of learning as we go and pulling support from the different people that you have around you.
Ursula, do you want to?
Yeah, sure. The question made me think about being a gymnast. And when you're a gymnast, you spend a lot of time doing conditioning exercises, a lot of sit-ups, a lot of push-ups, a lot of pull-ups. And I was a gymnast, so I did a lot of that growing up, conditioning every day. And I think self-compassion is like that, it's a muscle, and once you've developed it, it is easier to find, but you still need to do it. So what do I mean? I mean, like, I have, like, underneath my physical structure, I have this foundation that I built from being a gymnast for many years. And if I don't take care of myself, it kind of, it becomes less accessible, but it is easier to go back now that I did that foundation. And it wasn't because I did it right or I was good or I, was a perfect person. It was because I kept trying, every day to do this, even when I didn't want to. I did the sit-ups even when I didn't want to do it, or I did, took a break if I needed to, but I came back. So the point being, it's a muscle that can be established, and then also, like any muscle, you need to keep working it, and that there'll be times when maybe you're not exercising as much, and and that's when you might need to pull in some of your friends or supports to say, you know what, I need to go for a walk. And by walk, you mean self-compassion. So there is a nice overlap with exercise, I think, in that it is really like a muscle. Do the foundation, but keep coming back to it and use social support to maintain it.
Yes, great. Love this. I know we're reaching the hour, but there's still a couple questions that I really want to get to, and I don't think they'll take too long. Is there a favorite resource or website for learning more about recovery and mental health? And actually, you guys could probably just type that into the chat to the entire audience while I ask the next question, which is, how should I sell, and sells in quotes, DBT as a helpful therapy?
I can answer this. So DBT is this giant package of a therapy. It includes individual therapy, group therapy, which is really like a class that's 2 hours long. Therapists meet weekly as a part of a consultation team. There's coaching outside of therapy. That package is so rarely available that when people say, did you get DBT or not, what they're really talking about most of the time is, did you get a piece of DBT? And so that's maybe what the first question I would have. The second question I would have is, or the second thing I would say is that DBT is one set of tools for managing emotions. And if you're interested in some additional ideas for how to do this, it's a great place to start. And you can find a book on Amazon that is by Marsha Linehan. I think it was released in 2015. That is Strategies, it's a spiral ring book. These are not the only strategies for managing stress or emotions, but they're a good chunk, a set of them. And again, that's only a piece of what DBT is, but I would say if you're interested in some additional ideas for how to manage your experience, these are some things to try. Many people have found them helpful. They may or may not work for you.
Great, thanks.
From my
And
I was just going to say, from my perspective as a certified peer specialist, anytime we're talking to a peer about a new tool that they might find helpful, it all has to come down to personal choice and whether they are ready to try this new tool. So I kind of, the word sell makes me a little uncomfortable. I think the best you can do is present, hey, I have this tool that I know of. Here's what it is, and it ultimately comes down to self-choice or personal choice and whether they're ready to take that step and try that particular tool.
Yeah. Okay, so along with is there a favorite resource or website for learning more about recovery and mental health? There's also the question, is there any online training for peer support counseling?
Not in Pennsylvania. I don't know about other states or other countries. In Pennsylvania, it's solely a face-to-face training.
I know I took one online course. I did a little components of it for the peer support counseling. To be honest, it wasn't that good. So that's why I didn't continue with it. So I personally would recommend the face-to-face. Ursula, you were going to say something?
I would check out DBSA. I'm open to other people's thoughts or comments on this, but DBSA, Alliance Depression Bipolar Support Alliance, might be a good place to go. I'm not, but don't quote me on whether they have online peer support training.
Yeah. And I guess favorite resource or website for learning more about recovery and mental health. I don't really have a favorite. I know there's so many of them if you just Google it. Mental Health America, the Depression Bipolar Support Alliance. Of course, now I'm blanking, but I think if you Google it, you can find them, unless you guys have something off the top of your head.
I might add SAMHSA's Consumer Affairs Office as a source.
Yeah, good one. Thanks. Okay, well, we're past the hour. This was awesome. You guys were great. Ursula, you had so many great analogies, and Dave, your honesty was so touching and so insightful and quick. DeQuincy, sorry, I told you I would do that.
No worries.
DeQuincy, just everything you're doing, and I didn't even know that you had cartoons, that you did cartoons. So I learned something new every time too. So this was incredible, and I can't thank you enough for doing it and for being here. And I want to also thank the audience for hanging in there and attending. And I hope you found it to be as useful and as valuable as I did. And so thank you all.
Thanks everybody for joining.
Yes, thanks. Bye, guys.
Bye everyone. Bye.